Welcome to Olympian Water Testing, giving you the best in water analysis. Today we're looking at TAP score. Why is fluoride used in water treatment? So it has cost benefits, controversies of artificial water fluoridation. Is it good? Is it bad? Why is it done? Let's take a look. So for many, fluoride is among the most confusing chemicals added to drinking water. Low concentrations of fluoride, 0.7 parts per million, are known to improve dental health. It's been hailed as one of the public health's great success stories by some. But there's another side to it. For others, however, artificial fluoridation remains a highly contentious issue. There have been debates over known health issues versus the potential health risks, and about everything in between, including the issues of personal choice and political implications. So taking a look at the history of it, the first research into the effects of fluoridated water began in the early 19th century as researchers established that fluoride occurs in varying concentrations in bones, teeth, and drinking water. And by the 1930s, it became evident that moderate levels of fluoride prevent dental caries, and in 1945, U.S. water systems were actively adding fluoride in public water supplies. Now, there's a cost versus benefit analysis to take a look at. While there's no federal mandate to fluoridate water, by 2014, nearly 75% of the U.S. population in the public water system had access to fluoridated water. It is widely considered to be a major factor in the 25% decrease in rates of tooth decay in the United States. Now, is that true? How does that work? How does fluoride actually improve dental health? So the addition of fluoride to drinking water prevents dental caries because it maintains a consistent low level of fluoride in the mouth, specifically in dental plaque and saliva, and this reduces the rate at which the tooth enamel demineralizes, as well as increases the speed at which the teeth are able to remineralize in the early stages of cavities. Now, what are the risks associated with fluoride in water? While data clearly indicates the benefits of water fluoridation, it also has indicated that there may be adverse effects, particularly at elevated levels. One risk associated with fluoride water is dental fluorosis, the change in the appearance of the tooth enamel due to excessive fluoride intake, and is most likely to occur when young children under the age of 8, regularly consume large amounts of fluoride while their permanent teeth are still developing. And the hypermineralization of enamel from excessive fluoride intake results in the intrinsic tooth discoloration. That's a very common result of water fluoridation. And along with that, skeletal fluorosis is a debilitating effect of too much fluoride in the water. And groundwater with naturally occurring fluoride affects 200 million people worldwide with skeletal fluorosis in regions like Bangladesh and India. So there is a big downside to it. Controversy surrounding artificial fluoridation, often considered one of the most feasible and cost-effective methods of fluoride to all members, U.S., regardless of age, education, or income. The U.S. public health system has published fluoridation statistics periodically since 1956, and the reports have been given rise to ethical, economical, and health concerns. Some argue that water fluoridation pits individual rights, the individual's inability to choose whether the water has fluoride or not, against the common good, the decision to fluoridate water for the common benefit. And also proponents of individual rights perspective on fluoridated water are dissatisfied that individuals have no choice about the additives to water they drink. Others argue the common good should take precedence over individual rights, equating artificial fluoridation with vaccination or food fortification. And some have suggested that artificial water fluoridation is possibly linked to an increase of cancer. However, recent population-based studies using cancer registry data have found no evidence. Fluoride has also recently been categorized as a neurotoxin, and neurotoxicity occurs when we're exposed to a substance, natural or artificial, to a degree that alters the function of the nervous system, causing tissue damage and impairing the process and transmission of information. Acute fluoride poisoning is possible, resulting in neurotoxicity, but it's nowhere near the 0.7 parts per million concentration added to drinking water. And another neurological concern to fluoride is the potential connection between fluoride and ADHD, attention deficit hyperactivity disorder. Since a popular study on fluoride and neurodevelopment began in 1992, the percentage of the U.S. population that drinks fluoridated water has increased to 56 to 75. During that same time frame, the percentage of children with HDA diagnosis has increased from around 7% to more than 11%. So there's a lot of controversy surrounding water fluoridation, with some proponents on one side saying it's good and others saying that's bad. But we can clearly see there are some negative health effects. That's why it's always a good idea to periodically test your water for different levels of fluoride.